Have you ever wondered why certain aspects of your adulthood seem challenging, despite your best efforts? Could it be linked to something that happened in your childhood? Well, let's embark on a journey of understanding as we unravel the complex connection between adult attention deficit hyperactivity disorder, or ADHD, and experiences of trauma in childhood. ADHD is a common neurodevelopmental disorder, often starting in childhood and persisting into adulthood. It's characterized by symptoms such as difficulty focusing, impulsivity, and hyperactivity. However, in adults, this hyperactivity often transforms into an internal restlessness, making it a bit of a chameleon in the realm of mental health. But here's the twist. Recent studies have surfaced, suggesting a link between childhood trauma and the development of ADHD in adults. Childhood trauma, be it emotional, physical, or sexual abuse, neglect, or exposure to domestic violence, can significantly influence the development and severity of ADHD symptoms. It's like a shadow from the past, casting a long and sometimes disruptive influence on the present. To add another layer of complexity, these symptoms of ADHD can be exacerbated or even mimicked by the effects of childhood trauma, making diagnosis and treatment a challenging task. It's a bit like trying to solve a puzzle, where some pieces can fit in more than one place, and others look surprisingly similar. But don't worry, we're not here to leave you in the labyrinth of confusion. Over the next few minutes, we'll delve deeper into this intriguing topic, exploring how the tendrils of our past can shape the landscape of our present. So buckle up and get ready to explore the intricate connection between adult ADHD and its roots in childhood trauma. So let's delve deeper into this topic and explore how our past can shape our present. Adult ADHD can sometimes feel like an unwelcome guest that overstays its welcome. But did you know it can manifest differently than it does in children? Let's pause for a moment and imagine ADHD as a chameleon. In children, it often shows up as hyperactivity, impulsiveness, and difficulty maintaining attention. Picture a small child bouncing from one activity to another with the energy of 1,000 suns. Now let's take that chameleon and fast forward a few years. In adults, ADHD often morphs into struggles with time management, organizational skills, and maintaining focus on tasks. The hyperactivity that was so visible in childhood may now present as a relentless inner restlessness. But here's where the plot thickens. Throw in the wild card of childhood trauma and the picture becomes even more complicated. Childhood trauma, be it emotional, physical, or sexual abuse, neglect, or exposure to domestic violence, can exacerbate ADHD symptoms or even mimic them. Yes, you heard that right. Trauma can be a master of disguise, masquerading as ADHD and leading to a potential misdiagnosis. So, how does this happen? Well, it's all about the brain. Trauma affects brain development and can significantly alter the stress response system. Think of it as a computer glitch that disrupts the normal functioning of the system. This disruption can potentially increase the risk of developing ADHD-like symptoms. This intricate relationship between ADHD and childhood trauma is like a tangled ball of yarn. Adults with a history of trauma may present ADHD symptoms more intensely, and conversely, those with ADHD are at a higher risk of experiencing traumatic events. It's a cyclical relationship that keeps turning like a never-ending merry-go-round. Indeed, the intricate relationship between ADHD and childhood trauma presents a complex clinical picture. But as we unravel these complexities, we gain a clearer understanding of how to approach diagnosis and treatment. And that, my friends, is a step in the right direction. It's like a tangled web, isn't it? The more we pull, the more entangled it gets. This is a fitting metaphor for the cyclical relationship between ADHD and childhood trauma. It's a complex, intertwined cycle that's as hard to unravel as a spider's web after a storm. Imagine two circles, one representing ADHD and the other childhood trauma. Now picture these circles overlapping, creating an intersection of shared experiences. This is where adults with a history of trauma may present ADHD symptoms more intensely. The trauma they've experienced has left a lasting impact, disrupting their brain development and potentially leading to ADHD-like symptoms. But here's where it gets even more convoluted. Those with ADHD, due to their impulsivity and risk-taking behaviors, are also at a higher risk of experiencing traumatic events. It's like a never-ending merry-go-round, where one feeds into the other and round it goes. Perhaps you're thinking, well, that sounds like a knotted mess. And you're not wrong. It's a complex cycle that can leave individuals feeling like they're stuck in a perpetual loop of trauma and ADHD symptoms. But it's not all doom and gloom. Recognizing this cyclical relationship is the first step towards breaking the cycle. By understanding the intricate relationship between ADHD and trauma, we can begin to develop more comprehensive and effective treatment strategies. So, while it may be a tangled web, it's not impenetrable. With the right tools and understanding, we can start to untangle the knots and pave the way for healing and growth. Breaking this cycle is vital. And this leads us to the question, how can we address this issue effectively? Let's explore that in the next scene. Breaking cycles can be tough, but it's not impossible, especially when it comes to something as complex as ADHD in adults. When life gives you lemons, you don't just make lemonade. You make a lemon meringue pie, a lemon tart, lemon sorbet. You get the idea. But what if those lemons are ADHD symptoms exacerbated by childhood trauma? Well, you roll up your sleeves and you get to work. So let's talk about the various approaches to addressing ADHD in adults. Remember, there's no one-size-fits-all solution here. It's more like a buffet. You choose what works best for you. On one hand, we have medication. They're like the little soldiers fighting on the front lines, helping to manage ADHD symptoms. But just like in any battle, the infantry alone often isn't enough. That's where our special forces come in, psychotherapy. Now, don't get all Freudian on me. We're not talking about lying on a couch discussing your dreams. We're referring to cognitive behavioral therapy, or CBT for short. This form of therapy has shown its mettle in managing both ADHD and trauma-related symptoms. It's like having a personal trainer for your brain, helping you build mental muscles to tackle your symptoms head-on. But wait, there's more. Remember our childhood trauma? It's time to face that head-on too. Understanding and healing from these early life experiences can significantly impact the management of ADHD. It's like going back in time and giving your younger self a comforting hug, a listening ear, and the assurance that things will get better. So we see that addressing ADHD in adults is like playing a game of chess. You've got to think several steps ahead and consider all the pieces on the board. And just like in chess, sometimes the smallest pawn can make the biggest difference. It's clear that addressing both ADHD and childhood trauma is crucial for effective treatment and management. Remember, you're not just breaking a cycle, you're forging a new path, one that leads to a healthier, more balanced you. Navigating through the maze of ADHD and childhood trauma is no easy task, but it's not a journey you have to take alone. As we've seen, ADHD is not confined to the realm of childhood, and its roots can often be traced back to early life traumas. This complex interplay between ADHD and trauma can influence how symptoms manifest and the severity with which they are experienced. In our exploration, we've understood that adult ADHD can show up differently than in children, often presenting as difficulties with time management, organizational skills, and maintaining focus. Childhood trauma, on the other hand, can exacerbate these symptoms or even mimic them, complicating diagnosis and treatment. Recall the cyclical relationship between ADHD and trauma. Adults with a history of trauma may experience ADHD symptoms more intensely, and inversely, those with ADHD are at a higher risk of experiencing traumatic events. This cycle underscores the need for comprehensive treatment approaches that address both ADHD and trauma-related symptoms. We've also discussed the importance of breaking the cycle, of seeking professional help to manage symptoms and heal from past traumas. Medication can often help, but psychotherapy, particularly cognitive behavioral therapy, has shown efficacy in managing both ADHD and trauma-related symptoms. As we wrap up, let's remember to extend understanding and support to those grappling with the intertwined challenges of ADHD and childhood trauma. It's crucial for us as a society to create an environment that fosters understanding, acceptance, and healing. As we conclude, ponder over this. How can society better support those grappling with the dual challenges of ADHD and childhood trauma? Remember, every discussion brings us a step closer to understanding. Don't forget to subscribe for more insightful discussions like this one.